Hi friends, today we are going to discuss a new set of MCQs that are going to be 10 in number, and also we will try to solve them. So please stay with me for the duration of this whole video. Thank you. So our first MCQ of this video is the catabolic enzyme acetylcholinesterase is found in the following location or locations of the human body. So we have to identify the correct option. Options are given. Option A is presynaptic membrane, B postsynaptic membrane, C red blood cell, D option is both A and B, and E is all of the above. So the correct option in these is E, all of the above, because acetylcholinesterase enzyme is found in all these sites of the body. Now the second MCQ, one of the following is an irreversible acetylcholinesterase inhibitor and thus acts as an indirect acting cholinergic agonist. So options are pralidoxime, physostigmine, galantamine, acetylthiophate, hydroponium. So in these options the correct option is D, because acetylthiophate is an irreversible acetylcholinesterase inhibitor and it is an indirect acting cholinergic agonist. Now moving on to the third MCQ, cyclopentylate is we have to identify the class for this drug. Options are anti-muscarinic agent, ganglion blocker, neuromuscular blocker, cholinergic agonist, adrenergic antagonist. So the correct option in this is A, because cyclopentylate is a anti-muscarinic agent. It is actually a cholinergic antagonist. So A is the correct option. Now moving on to the fourth MCQ, the following statements are correct about hydroponium except one. So we have actually to identify the statement about hydroponium that is not correct. So options are given. It is a reversible acetylcholinesterase inhibitor. B option is it is eliminated via bile into feces. C option is its duration of action is 10 minutes average. Its actions are limited to the periphery. And E option is it is a quaternary amine. So actually all these statements are correct about hydroponium except B, because it is not eliminated via bile into feces, rather it is primarily excreted through the urine. Now moving on to the fifth MCQ, one of the following agents is used in the diagnosis of an autoimmune disease, myasthenia gravis. So options are hydroponium, physostigmine, neostigmine, pyridostigmine, galantamine. So actually in these options hydroponium is used as a diagnostic agent for myasthenia gravis. Now the sixth MCQ, Kala azar or Kala azar is another name for visceral leishmaniasis, cutaneous leishmaniasis, visceral schistosomiasis, cutaneous schistosomiasis, and cutaneous giardiasis. So actually the correct option in these is visceral leishmaniasis. Actually Kala azar is a synonym for visceral leishmaniasis. Visceral leishmaniasis is a chronic and potentially fatal parasitic disease of the viscera. Viscera actually means the internal organs, and the parasite involved is Leishmania donovani, and this parasite will infect the viscera, that is internal organs, especially liver, spleen, lymph nodes and bone marrow. So Kala Azar is another name for visceral leishmaniasis. Now the 7th MCQ, one of the following is useful as an adjunct in the quitting of a smoking habit. So options are amphetamine, methylphenidate, dexmethylphenidate, varenicline, nicotine. Actually, varenicline is used as an adjunct in the quitting of a smoking habit. So D is the correct option here. Now the 8th MCQ, one of the following statements is correct about varenicline, whose brand name is Champix. Which is that one? Actually, we have to identify the correct statement about varenicline among these 5 options. So options are given. It is a partial agonist at nicotinic receptors in CNS. It is a full agonist at nicotinic receptors in CNS and PNS both. CNS central nervous system, PNS is peripheral nervous system. C option is it produces more euphoric effects than nicotine. D option is it is safe generally and needs no patient monitoring. And last option is first line agent in alcohol quitting. So actually the correct statement among these about varenicline is A, as varenicline is a partial agonist at nicotinic receptors in the CNS. It is actually a partial agonist. Now the 9th MCQ, hemolytic anemia is the adverse effect caused by which one of the following classes of drugs? So classes of drugs are given: aminoglycosides, tetracyclines, macrolides, sulfonamides and fluoroquinolones. Actually among these options, sulfonamides are the drugs that will cause hemolytic anemia as the adverse effect. Now the last MCQ of this video, tramadol is a centrally acting analgesic that exerts its pharmacological effect via binding to. Actually we are asked to identify the mechanism through which tramadol acts. Actually the receptors are involved in its mechanism of action, so we have to identify the correct option. So option A is mu opioid receptors, kappa opioid receptors, delta opioid receptors, zeta opioid receptors, or all of the above. Actually tramadol acts centrally via mu opioid receptors, and in this way it will exert its pharmacological effect as an analgesic. So friends, this was all for now. Thanks for watching.